Great Lakes Bay Health Center has provided me with so much community, which I know that I always need, and I always value community.
We have been a safety net provider for Bay County residents since the 1980s, delivering high quality and affordable health care across multiple service lines.
It's just, everyone is super friendly. Everyone knows what's going on. It's like everybody knows your story without you having to repeat yourself over and over and over.
However, we are at a crucial juncture where our existing facilities can no longer meet the demand for our services. Our current sites have long waiting lists, space limitations, and lack of capacity to serve more patients. In 2024 alone, 17,996 patients visited Great Lakes Bay Health Center sites in Bay County, and 66,152 patient visits were scheduled across multiple disciplines.
And as I continue to work with Great Lakes Bay on my health, they've really helped me. I would borderline say they've helped save my life.
However, these numbers only scratched the surface of the needs in our community. There are nearly 100,000 Bay County residents, with more than 31,000 of those folks living below 200% of the national poverty level.
I really feel like Great Lakes Bay Health saved my life because I called and asked for another ultrasound and they did it. Like, they really didn't have to do that. So I was very grateful for that.
Many face significant barriers to health care, often prioritizing basic needs over medical care. Of these individuals, our current facilities limit us in how many of these residents we can see for care. In fact, nearly 70% of them aren't patients with us. They are likely missing out on regular primary health care and don't have a medical home.
You know, they have people to serve you and help you. And from my experience, they've treated me very well.
They're just always happy.
Together, we are building a healthier and stronger Bay County with an expansion to meet the growing demand. This will allow an increase in primary care, OBGYN, dental, vision, and behavioral health and psychiatric services. We anticipate being able to see an additional 28,750 patients per year, expanded access to 23,000 additional dental visits per year, provide 7,000 additional vision visits per year, along with decreasing waiting times. This life-changing project will cost us more than $30 million to make it reality. While we will finance the majority of that, we are seeking community support to raise just 5% of that total cost, or $1.5 million. And our goal is to raise this funding through the capital campaign to bring this vision to life.
Just all around, a whole health atmosphere. They take care of your whole health. And if you got questions, they answer. And then they ask you if you have more questions. They dig deeper.
This expansion will ensure that no one in our community has to go without essential medical, dental, vision, and behavioral health care. We will help people see better, give babies a healthier start to life, and support patients so that they can turn around chronic illnesses like diabetes and high blood pressure. Together, we can transform healthcare accessibility in Bay County. Invest in our future and make a difference today.